everyone, and welcome to Your Healthy Dose, a podcast about current trends in healthcare. I'm Kim Douglas, your host. So let's get started. Today's topic is so important. What we're talking about today is COVID, myths and facts. And I'm very happy to have here with me Dr. Debesh Das. You are the program manager for infection prevention and hospital epidemiology at Providence St. John's Health Center. And you also are the resident expert on infectious diseases. And I have been told that you've been instrumental here at St. John's regarding COVID-19 over the past 2.5 years. Welcome and thank you for being here.
Thank you for having me here.
Yeah, wow. You've had a busy 2.5 years.
Yeah, I'd like to take a nap sometime, I guess, from all this, but it's been very interesting.
Oh, I can imagine. So tell us, to get started, what a preventionist is, because you are an infection preventionist, and I haven't heard that term.
Yeah, it's actually not a totally common term, obviously. So infection preventionists, what they basically do is, the whole idea is they want to prevent infections, just as the name implies, and particularly infections in the hospital. So when people get admitted to the hospital, they're coming in with whatever issues that they may be coming in with, and we're there to make sure that while they're in the hospital, they're not getting any infections from within the hospital.
Wonderful.
And so that's kind of what we do.
And how did you get into this field?
So I actually had many mentors throughout the years, and one of my mentors had talked about public health, and this is prior to me going to medical school, had talked about public health and the need for hospital epidemiology and infection prevention and how important it is and how important it's going to be in the future. And so I had that little earworm in the back of my mind, I guess, for a while, all through medical school. And once I completed medical school, for some reason, something really appealed to me. And public health and infection prevention really spoke to me. And I said, I want to do more of this. And so that's how I kind of got involved in all that.
Let's talk about the elephant in the room, COVID-19.
It's a very familiar elephant.
I can imagine. So, we've all been through so much these last couple of years, and we recently surpassed the 1 million deaths in U.S. from COVID. So let's really get down to the basics. Where are we at with the pandemic? You are the guy to talk to.
So that's actually a good question. And I think there's a lot of people throughout the world that are trying to figure that out. And the reality is no one really knows where we're at or where we're going per se. We do know where we've come from and the lessons that we've learned from that. Right. And we're using that to help guide us in whatever comes our way after this. The reality is there's probably going to be more variants as time goes on. There might be more Omicron subvariants. The reality is no one has a crystal ball.
Right.
And so we don't know, but all we can do is kind of gear ourselves with the knowledge that we have and with the tools that we have and kind of move forward in this pandemic.
Did you have any concept that it would be as long as it has been?
To be honest, at first, I wasn't sure. I knew for like the first 3 to 6 months, it would be the way that we saw it happen. And after that, it was kind of anyone's guess.
Yeah.
And we were talking about, maybe in about a year and a half.
Right.
And a year goes by, a year and a half, 2 years go by. And now everyone's like, maybe 5 years, maybe 10 years, And so we have some people that can do some forecasting.
Yeah.
That may help. We have virologists and other experts that are looking into that to see where this is going to go. But the reality is we know we're in for the long haul, but we just don't know how long of a haul it is.
Regarding COVID, are you involved with patient care?
Yes, there's, large management teams that are taking care of COVID patients. And while I may not always directly be involved at the bedside, the management, I work with the physicians and the other caregivers that are there to make sure that, for example, the patient in the appropriate room, that the ventilation system that we have set up there is properly working, that anyone going in and out of those rooms, they're taking the proper precautions, wearing the right personal protective equipment, washing hands, things like that. Because the big part of it is with COVID-19, while we round in those units, we want to make sure that There isn't any situation where we're inadvertently transmitting disease, things like that, having any kind of cross contamination. And so that's really kind of where my role comes in, to make sure that, if we're caring for these, very sick COVID-19 patients, that we're not only providing the right care for them, but we're making sure that anyone else that are providing care for the patient, or anyone else that's there, that we're not creating any situations where we're allowing it to spread within the hospital, which is a really big thing, obviously. So that's also kind of where our role comes into COVID-19, as well as, advising on, this is the latest information about COVID-19. This is what we should be doing. And I've had conversations with physicians and things like that a lot of times about, hey, this is how long you should be isolating for. We need to make sure we're following our protocol and things like that. So,
And that changes often, right? We've gone from 10 to maybe 5 days or whatever. Things change.
Right, absolutely. Early on in the pandemic, we were doing, I think, like 21 days.
Yes.
And as more information comes out through the county, through the state, things like that, we're able to update those practices. And we're also looking to see, evidence-based practice, like what's actually out there that's being done through evidence.
Right.
And so we're able to look at all those things together and sort of properly manage the entirety of that patient getting their treatment.
It is a big job, definitely. On a personal note, I just want to ask you, when do you feel the masks? Will we have masks now for a long, long time?
Yeah, in the hospital setting, the masks, obviously, if you go into any kind of hospital, you have to wear a mask. If you go to other places like retail places, department stores, restaurants, you don't necessarily need to wear them. But I foresee that moving forward, even in hospitals, because they're very vulnerable places, right, for a lot of people. And so you have all kinds of people with varying levels of being sick that are coming through there. And so I think moving forward, until things take a drastic change, I think there's no real sort of situation where we're not having to wear masks while we're in the hospital.
Very good. Okay, are you up for playing a game?
Sure,
All right,
absolutely.
let's do. So can I run through a few things and you tell me if it's myth or if it's truth?
Sure.
All right, here we go. I see a game show in our future.
All right.
Okay. Number one, a negative COVID test means you're safe.
Myth.
Really?
Yeah.
Why?
It's myth in the sense that when you do a COVID test, it's really like taking a picture. So if you take a picture of someone, 20 years ago, and then you take a picture of them 20 years later, they're not going to look the same.
No.
So similarly, when you have someone take a COVID test, it's literally like pressing the pause button. And for that very moment, you could say, yes, they're likely negative based on the test. But all of that literally, if they after that, say, were to go out and go party with no ventilation, things like that, and then a day and a half later, they could be positive. And realistically, I've even seen things where someone's positive in the morning, or someone's negative in the morning, and later that day, like maybe a few hours later, they become symptomatic and they retest again in the evening and they're positive. So it's really sort of a picture in time. That's really what a negative test is.
Wow. Okay, number two, and I've heard this a lot. Herd immunity will eventually end the coronavirus pandemic, so vaccinations are basically not necessary.
That's definitely a myth.
Okay, why?
So even if you look at other viruses that we have, like influenza, we get the flu vaccine every year.
Yeah.
Things like the flu, coronavirus, these mutate very quickly and very often. That's why we've seen all these subvariants of Omicron. Omicron came out in November of last year, and it's now June of 2022, and there's all these subvariants. So viruses typically tend to mutate, especially RNA viruses, which is what coronavirus is. And so based on that, it's likely not that, not getting a vaccination will help in that it'll be kind of taken care of by herd immunity. It's just not a realistic forecast, I would say.
Okay, number three, and you're doing great, by the way. The ingredients in some of the COVID vaccines are dangerous.
I would say that's a myth.
Why?
The two main COVID vaccines, the mRNA vaccines, the Pfizer and the Moderna, they're both vaccines that don't really have preservatives. They're things that need to be sort of thawed out. And so the components that are in that, they're no different than other mRNA vaccines and treatments that we've used, like, for example, for cancer prior to this. And they've been used very extensively. And from those studies, from mRNA, vaccine type, technologies being used for cancer prior to COVID-19, there's like 10 years worth of research that was done on that, and there hasn't been anything that has come out. And, one of the common things is like, egg allergies and things like that
Yeah.
people ask about. And none of those components that you would typically find in some other vaccines like that are in the mRNA vaccines that we use for COVID-19.
Okay. Number 4, I get some protection from COVID-19 if I've already had COVID-19. So then I'm fine.
I don't know if this is one of the options, but that's partially true.
Okay.
And it's partially false in
Tell
the
us.
sense that you do have some level of immunity when you first get the infection.
Right.
And that can, last up to about 90 days. And beyond that, though, there's no real understanding of how long a person remains immune beyond that time. In studies that have been done, and this is through the CDC, I think last year, there have been multiple studies that showed that people that had COVID-19 but were not vaccinated they're 2 times as likely, I believe, to get reinfected versus people that were vaccinated and had COVID-19 and then vaccinated. What's really driving, the sort of campaign to have people get vaccinated is not so much or primarily to prevent getting the current variant that's sort of around, but it's really more to make it so that you don't end up getting really, really sick from it.
Gotcha.
And that's really kind of where the push is. And so at this point, we're at a place where, yeah, you can still technically get the virus even though you're vaccinated and boosted, but there's a much better chance of you not ending up in the hospital because of it.
Yeah. A lot of people are saying kind of fluish like symptoms, things like that.
Exactly.
And that's probably true with the boosters as well. Okay. Number 5, I've had COVID already, so I can't get it again.
That's 100% myth.
Myth. Why?
Yeah. So, just like getting a cold, if you look at it from the standpoint of getting a cold, if you've had a cold, I'm sure there's multiple times throughout your life where you've remembered having a cold.
Right.
And so, the way our bodies work, viruses mutate and our bodies have immunity or antibodies to certain kinds of viruses. But as the virus changes, our bodies have to adapt to it too. And so that's why we can get reinfected, whether it's from the cold virus or from COVID-19 and various other variants.
So would you say like literally you don't know enough, like you really could get infected 5, 6, 7 times or
theoretically,
Really?
if you have the time enough, like if COVID-19, if you're looking 10 years down the road,
Sure.
you'll definitely find people that may not be very cautious about their own protection and about vaccinating and things like that. And it's totally within the realm of possibility that over, say, a 10-year period, you could have someone that had COVID. I mean, I would hate to be that person.
Yes, exactly.
But it's absolutely theoretically possible over time, provided everything we know and the way the virus works as it stands now.
So I don't want to jinx it, but I've never gotten COVID. Why do some people never get COVID and then other people that are vaxxed and boosted get COVID?
Yeah, I think that's a very interesting question. The reality is no 2 individuals are the same. We're all human beings, but all of our physiologies are a little bit different. The way our bodies work are a little bit different. There are slight variations. And the genetic makeup and the genes that we have also vary person to person. And so there's some people that are more likely to get certain kinds of illnesses, and there's some people that are not. And COVID-19 is no different. And so there's certain ways that COVID-19 is able to enter into the body and get into a person and cause all kinds of problems and wreak havoc, right? So there are certain situations where, there might be people that have or don't have receptors that allow COVID-19 to come in. And there's some anecdotal evidence that there are some people that, maybe lacking certain receptors that COVID-19 needs to connect with to be able to enter into a person
Right.
and cause infection. And so those people are probably less likely to end up getting infection. There are some people that just genetically may be predisposed, just like there's people predisposed to getting diabetes and cancer and things like that. And so COVID-19 is no different. So that's why we see such a variation in how there's people that have never had COVID-19, such as yourself, and hopefully never.
Thank you.
And there's people that have probably had COVID-19 twice,
3
maybe
times.
working on their third time, their hat trick.
I have a question for you. Have you had COVID?
Knock on wood, I have not. As far as I'm aware, I've tested and
Same
all those kind of things. And there's times where I thought I did have it.
Yeah.
Apparently I didn't, and I still felt like I had it, even though I was very, very sick. But apparently I was told that it was not. So, I don't know if that's based on meticulous. I'm very good about masking and everything. I don't know if it's part of that or if it's just physiology or what it is, but. I'm not banking on the fact that it's my own physiology. I'm going to keep banking on the science and masking and hand hygiene and things like that.
Good advice. So what distinguishes St. John's in the way that it's approached COVID care?
I think with St. John's, one of the things that St. John's always really does well is that it presents itself as this very warm, compassionate, community-based, like family hospital. But the amount of intellect and technology and resources that we have, we act like one of the larger institutions. And so I think during COVID-19, at least through the initial part of it, we were really at the forefront, just with like everyone else, like with some of the other health systems that are around, in terms of supporting the community and really kind of being there to take anyone that was coming in and treating them and going through the hours and hours of just painstaking work of treating these folks. And so I think that's how St. John's handled it, and they didn't shy away, and they were right at the front, saying, rolling up their proverbial sleeves and providing care through ECMO and things like that. And very early on, there was a big push to do research in remdesivir, which was the initial antiviral agent, which I think we're all familiar with now. Initially, it was just sort of like only provided based on if hospitals were going to do research to see, because we didn't have enough data on that.
Right.
And so St. John's was very instrumental in bringing that here and making it so that patients that had COVID-19 but were not hospitalized, they were able to come in and get that treatment. And that was through our research that we had done, I believe through our ICU and through other means. And so that's something that we had going for quite a while. And I can't remember how long. I know obviously the study has ended, but it ran for quite a while. And we were able to really not only give back to the community and help, but we were able to do some very much cutting edge research that would then later inform how remdesivir fared in a lot of these patients. And so it was very vital research that was done at St. John's, I would say.
So, Dr. Dosh, you mentioned ECMO. ECMO. What is ECMO?
So ECMO, and sometimes even I have to remember because they're very complicated words. So ECMO is basically extracorporeal membranous oxygenation.
I'm so glad you said that, and I didn't. Tell us now what that means.
So ECMO is basically, if you're familiar with dialysis.
Yes.
So dialysis, what that does is it takes the blood out of the person and it filters it the same way the kidneys would, especially in patients that have kidneys that don't function very well.
Yes.
It then filters the blood. You're able to put stuff back into the blood that you might need, and it goes back into the person, right, into the patient. ECMO does something similar where it'll take the blood out, and these are for people that have very severe respiratory disease, where their lungs are not able to function in the best way possible. Someone that has very bad COVID-19. infection. And so, for those patients, and it's not just limited to COVID-19, but anyone
Right.
with very severe respiratory disease. And so what it allows them to do is take the blood out and literally put the oxygen into the blood and then have it go back into the person so that their lungs get sort of a break from having to work and, do the oxygen exchange and things like that.
So, doctor, how new is it using ECMO to treat COVID patients?
So ECMO is something that's been around before the COVID-19 pandemic, but it really kind of took central stage, at least at our hospital, among other places that have the capacity. And one thing I want to make very clear, ECMO is not something that's common in a lot of hospitals. You could have them in large health institutions. St. John's is very fortunate to have that as a treatment modality, and it's not common as of right now that any hospital you walk into is going to have an ECMO program.
Yeah.
And so it became very vital because, as I was describing, you have these very sick patients and, their lungs are not working very well at all. And so having an ECMO program and being able to provide that care for them is very, very special, I would say. And, like I said, it's not something that's available in all hospitals as of right now. And so it gives St. John's the ability to take really the sickest of the sick and to be able to treat them, and not just treat them, but to get like world-class treatment. And so I think ECMO, because it's not so common, there have been people that have come from all over the state, specifically to St. John's because of the ECMO program. We've had people flown in from outside of the state that were very sick with COVID-19 that came to St. John's for treatment because of the ECMO program that we have. And so it's extremely vital in everything that we've done COVID-19, and particularly the first year or so. It's just been the central sort of pathway for us to help treat a lot of these very sick patients.
Wow, it sounds like a great advantage for patients that are suffering from that. So let's talk a little bit about you.
Sure.
What attracted you to working at St. John's, and do you have a personal history with St. John's?
So the first part of the question, St. John's, growing up in LA, it's just always been a stalwart in terms of top-notch medical care. And, we were talking a little bit earlier, my father is a nephrologist, which is a kidney specialist.
Right.
And he works out in the South Bay, but back in the 80s, he used to cover one of his colleagues out here at St. John's on the weekends. And he did that through the 80s, all the way into the early 90s, I would say. And I used to always hear such wonderful things from him growing up about St. John's. So it was kind of a slam dunk when I had an opportunity to come here that I'm definitely going to take it. And one of the other big attractions I've had to St. John's, about close to 20 years ago now, I would say, my mother was diagnosed with breast cancer. And, she's in remission now, and I'm very thankful to still have her to this day.
Yes.
And, she had come here for care. She was under the care of Dr. Giuliano, who used to practice here.
Yes, of course.
A wonderful physician. And
Yep.
so I remember coming here after her operation. She went to the cancer center for a checkup. And I remember coming here, and I was in the middle of medical school at that time, and I was in town visiting. And the amount of care and just the totality of the way they, kind of helped my mom through this whole process. And not just my mom, but my father and everyone else. And I deeply felt so, grateful towards St. John's that it was also sort of another attraction for me to come here and be able to give back to the place that helped keep my mom alive,
Wow. No
So-
better gift than that. And your mom is a warrior.
Yes.
And her and I have a lot in common. I had stage 3 breast cancer and was treated at St. John's, and the same thing happened with me and my family. So kudos to her, and many, many years of good health ahead for her.
Same to you.
Thank you. I appreciate that. So let's talk about the future. Do we need to be on our eggshells all the time? Tell us how to deal with this.
I think it's important to remember that COVID-19 is still out there. I think one of the things that I see once I leave St. John's and I'm out and about, I think there's a sense that COVID-19 is over or the pandemic is over, and that's really not the case. I think it's important that you stay up to date with your vaccines, boosters, that all those things that you've learned over the past 2.5 years about masking, if you're going to social events, make sure it's well ventilated,
Right.
preferably outside. I think it's important to still maintain those things. If you're in a crowded area, wear your mask.
Yeah.
I think you can't just say, oh, I'm done with this. And trust me, we're all tired of this, and we have been for a very long time. But COVID-19, whether we like it or not, is here, and it's going to stay. We don't know what it's going to look like down the road. It may end up becoming like flu, where we get like a vaccine shot every year, just like we get for flu. But the reality is that it's here and it's not going to go anywhere. And so we have to maintain a healthy sense of respect and caution towards it, I think. And that's what a lot of people I've seen have gotten kind of lax over the last 2.5 years, maybe.
Yeah.
But I think that's kind of the attitude that we have to move forward with.
And what about future treatments for COVID-19?
Yeah, I think one of the big mainstays is going to be antiviral medicine, basically. Currently, there's something called Paxlovid, which I'm sure many of us have heard about. It's basically an antiviral treatment. Patients who get COVID-19, and there's certain criteria, like they have to be at least 12 years of age, at least 88 pounds, things like that. But typically, this is for patients that have COVID-19 and they're able to identify within 5 days that they have it. And they're able to get this antiviral treatment called Paxlovid, which Pfizer makes. And it's basically this three pills that you take twice a day for 5 days.
Okay.
So it's a total of like 30 pills over 5 days. And basically, this is supposed to help people not get so sick that they end up in the hospital, And so they've used this as a mainstay for the current batch of Omicron variants or subvariants that we've been seeing. And I think moving forward, we're only going to get better with these kind of antiviral treatments. They're going to start developing more and more, aside from, updating the vaccines that we get. I think they're also side by side going to be sort of really working on these antiviral treatments. And they're sort of similar to like things like Tamiflu, which we take for flu, right?
Yep, you get that scratchy throat. You've
exactly.
Got it.
You take it. And I think moving forward down the road, I think it's going to be sort of a two-step thing. One's going to be the vaccination. The other thing's going to be these sort of antiviral treatments.
Great. That's encouraging.
Yeah.
Okay, so how about you answered this? When it comes to infectious diseases, what keeps you up at night?
Yeah, I think there's a lot of things that keep me up at night, but with regards to infectious disease,
Right.
I think, there's a lot of things, there's a lot of factors. In this day and age, human beings, as a society, we're so mobile. And so it's not like 100, 200, 300 years ago. We're out and about, we're like running around the whole world. And so my concern is if for any reason we end up running into any kind of virus or whatever like we have 2.5 years ago, it's very easy to spread.
Yes.
And it's so hard to really hold people back from living their lives, and nor should they be. But at the same time, being able to track and limit and things like that in this day and age, it just becomes an impossible task. And I think that's the thing that keeps me up. It's not necessarily specific diseases, but, if it's the perfect storm
Right.
to allow for another type of pandemic. And that's kind of what really keeps me up, that is there a possibility of there being another similar type thing down the road? Because we live in such a society when it's sort of a double-edged sword.
Right.
I mean, it's great that we're able to do all these things with the technology and everything that's available to us, but at the same time, we're not, able to dial things back when we need to.
And things can spread so quickly.
Yeah.
You're so right. Well, this went by super fast. I so enjoyed hearing everything you have to say. And, there's so much information out there, Dr. Doss, that social media, every Tom, Dick, and Harry, forgive me, that doesn't really have your credentials or anything near you are giving us opinions about this. So it's so good to hear from somebody who really knows. So I want to thank you so much for being with us today. And I just also want to thank St. John's Health Center Foundation for providing us with this wonderful platform. And thank you to all of you for joining us today. And we'll be back next time.